you, Madam Deputy Speaker. I want to focus on a couple of key points. The first is about inpatient treatment for children in severe mental health crisis. The Select Committee's report last year found that there were too many children and young people in inpatient units subject to inappropriate care, far from home, without adequate understanding of their rights and subject to restrictive interventions. I think that far from home thing is a particular issue. So many children being sent out of county where it's too far away for their families to visit. And that's a particular problem for young people with eating disorders, because the beds are commissioned nationally. Even those who are clinically high priority may be sent out of county, isolated from their support networks. A recent BBC investigation found that children struggling with mental health problems during the pandemic were facing agonisingly long waits for treatment, with more than 1 in 5 waiting more than 12 weeks for it. And doctors reporting distressed children ended up in A&E as they had nowhere else to go. And that is another point that I particularly want to make to the Minister about the suitability. I know he's not the Health Minister, but I would hope he would pass it on to his colleagues, about the suitability of A&E for people presenting in mental health crisis. The number of A&E attendances by young people aged 18 or under with a recorded diagnosis of a psychiatric condition has tripled since 2010. And in Bristol, we've got a pilot, the idea of having a separate room for autistic children who come to A&E. And as you can imagine, you know, it's a hideous place to be, you know, even if you've just sort of burnt your hand or something. But, you know, the bright lights, the sirens, people rushing around, the whole sensory overload, especially at times when, as we know, A&E is full of people who are drunk or aggressive or violent, they can really add to a child's distress. So Bristol is trying to pilot a scheme where children are put in a separate place. But I would also argue that A&E isn't an appropriate place for anyone having a mental health crisis. Yeah, for example, a psychotic episode, they should not be sat in A&E. And I hope the government will look. I think Oxford's looking at how they can separate that out, and I hope the government will look at that. The other thing connected with that is that often youngsters are being treated for mental health conditions on general wards because there just aren't the beds available. Obviously, they don't get the specialist support they need there. The final thing is adverse childhood experience were mentioned, and obviously we've absolutely got to look at prevention, you know, whether it's children suffering from abuse in the home, domestic violence, extreme poverty, neglect, abandonment, and we've just seen so many terrible stories recently. And I think we just need to recognise just how traumatic that is for children and build that into our services. Just one example, where mothers and children are fleeing an abusive situation at home, they should be not be put in temporary accommodation where they might be sharing it with people who are addicts, people who have mental health problems themselves, who could be very aggressive. We need to make sure they have a safe place to stay.